So what is hyperbaric oxygen therapy? Hyperbaric oxygen therapy is the use of oxygen under pressure as a drug. And Dr. Tim Crow said it best when he said, "There's no other drug that rescues any sick tissue anywhere better than oxygen." Let's review a little bit about the history of hyperbaric oxygen therapy. The reason oxygen is crossed out on the top is because remember that oxygen wasn't even discovered until 1775. But the use of gas under pressure was discovered and found to be very beneficial in certain circumstances. So much so that chambers were built, pressurized by hand, because remember there was no air compressor, to compress air inside a big steel chamber in order to have beneficial effects. So they believed as early as 1662 that air at different pressures helped a number of different ailments. As that grew in popularity, in the 1830s, a copper chamber was created by Dr. Junod that went up to 2.4 to 4 ATA and was used for pulmonary problems. And these chambers were found to be so helpful to make people feel well that they were created in spas all over Europe. It was really crazy. There were hundreds of chambers like this throughout Europe as health spas. Again, still using regular compressed air because we didn't even know oxygen existed at that time. And then in 1870, Dr. Fontaine believed so much in the compressed air theory, and he noticed that he was a cardiovascular surgeon, that patients did much better under pressure when they were having cardiovascular surgery. Their anesthesias went better and they recovered significantly better. And that's probably because even though there was other gases dissolved in the plasma, oxygen was also dissolved at higher concentrations under pressure. And you can see the bellows on the right. They actually had to manually create that pressure in those bellows. Dr. Draeger in 1917 was probably the true father of pure oxygen under pressure. He realized that 100% oxygen under pressure helped scuba diving illnesses. It was he had a lot of foresight. Unfortunately, his ideas were not pursued at that time, but he was able to save a lot of scuba divers. Later, it became more important. But around the same time, people were still using compressed air for ailments, and a famous Dr. Cunningham found that respiratory and cardiac problems seemed to be much worse at high altitudes, particularly during the Spanish flu outbreak. He found that people did significantly better and healed better inside his hyperbaric chamber, still only using compressed air, but increased survivability at that time. He was so successful in curing people that one of his very grateful clients reciprocated and built him the world's largest hyperbaric chamber ever constructed. It was a steel ball. It was 6 stories high, 64 feet in diameter, and it treated diabetes, hypertension, syphilis, cancer, and much more. At least that's what they thought. Unfortunately, this grand unit, which again was only compressed air because it did have a smoking room, otherwise it would have been a gigantic bomb, was only helpful for a while because he couldn't prove anything. So Dr. Cunningham was going on about how wonderful his treatments were, but never came up with any good proof. And unfortunately, it was closed down by the government and was used for scrap metal during World War II. So what did we learn about air under pressure versus oxygen under pressure? So regular air at various pressures has been used in devices for over 300 years. That's pretty impressive. Oxygen wasn't even discovered until 1775, and sadly wasn't even used under pressure for another 165 years later. In the late 1800s, something great happened to hyperbaric oxygen. That was the development of the air compressor. Very important, and saved a lot of people's arms from compressing manually those gigantic chambers. Aside from Dr. Draeger in 1917, whose idea wasn't pursued, the use of oxygen under pressure really wasn't utilized until the 1960s. And it's very interesting to note, and I have this naval guy here in the picture here, because the naval trials and tunnel building in the early 1900s, the treatment of decompression sickness and others became evident, and the use of hyperbaric oxygen became much more important. And that's really probably how it developed. The diving tables that we use today for recreational scuba diving and even for air under pressure or oxygen under pressure were helped made by early naval trials, and many people literally risked their lives to help us make those dive tables today. So what happened to hyperbaric oxygen? Why hadn't it caught on? Why didn't it go everywhere it should have gone? And many of the reasons are because there were so many claims of dramatic successes, but really no good controlled experiments, which is hard to do and was hard to do in the olden days too. And that's something we really have to consider today. We have to be responsible as veterinarians, telling people that hyperbaric oxygen can help their pets. But really what we're hoping to accumulate is a lot of evidence-based medicine, which we're doing, and there is quite a lot of in the human field. You'll see there are thousands and thousands and thousands of papers in human medicine, and we're starting to see some more publications and research done in veterinary medicine. But sadly, by the early 1970s, there were only 38 chambers in use in the United States. Hyperbaric medicine today is validated, as I said, through thousands of evidence-based medicine studies. In 1998, there were over 10,000 published studies, so now there's probably another, I would bet to guess, over 30,000 published studies, if not more. And there's over 1,000 hyperbaric oxygen facilities for people in the United States and thousands more around the world. It's used much more in other countries than it is in the United States. And there's even credentialing for veterinarians, veterinary technicians. There are board certifications for hyperbaric medicine today. So it's so powerful and it's so useful and it's so accepted that Medicare covers emergency conditions and Medicare covers regular conditions. We're just going to focus today on the emergency conditions covered by Medicare, which helps us get through this a lot quicker, believe it or not. But actually, these are very good uses for hyperbaric oxygen, and they do save lives. We all probably heard about acute carbon monoxide intoxication. Hyperbaric oxygen will help reverse carbon monoxide intoxication, significantly improving survival. Decompression illness for scuba divers, gas embolism, gas gangrene, and we're going to talk about a lot of these things as we go through. But I just wanted to have this up here so you could see that not only do we believe its uses in veterinary medicine, but these are actually paid for by Medicare and Medicaid uses. And then there are some other uses that are validated but are not yet paid for by Medicare and Medicaid. Perhaps they should be. But then the ones that I have here that are not highlighted are some that I have a little bit of problem with myself that we really don't have a lot of proof on. And these kinds of things that they don't cover are important to mention also, because a lot of times we can be misled into wanting to believe something's going to help when it may actually not. And so until there's really good evidence-based medicine, we still have to be very cautious and cautiously optimistic about certain uses for it. So what is a hyperbaric chamber? These are pictures of human monoplace chambers. We call them monoplace because they're meant to have one person. If you use it in animals, you can actually have more than one person or pet inside, or animal inside, sorry. So what's the advantage of a monoplace chamber? Obviously lower cost, simple engineering, very simple, no electricity. It can be moved easily, but it can only do one patient at a time. The patient can't really be claustrophobic because they are shut into this chamber and confined. It only will go up to 3 atmospheres, which is perfectly fine for veterinary medicine. Obviously, it's pure oxygen, so it's a fire hazard. And then there are limited monitoring devices and you can only have limited medical delivery or monitoring devices inside there because you can't have electricity inside with 100% oxygen. Our multiplace chambers, which can treat multiple patients at one time. So these are images of people inside multiplace chambers. I show you this just so you know what we're talking about. It's not very practical for veterinary medicine, but in these chambers, they're similar to the ones you saw before, except they have room air inside, and then the people inside them breathe 100% oxygen. These can reach much higher pressures safely because room air is what's primarily being breathed by the other people in there. But other people can still become sick. It's sort of like scuba diving. You're breathing air under pressure, not oxygen under pressure, but the people in masks are breathing oxygen under pressure. But you can have monitoring devices. You can actually do surgery. You can have electrical equipment in there, so it makes it quite different. This is what an equine monoplace chamber looks like. I personally have not seen equine chambers. There are probably a number of varieties of them. This is just a picture to include for you. And this is what I have in my hospital. This is a small animal monoplace chamber, which we can fit several animals in at one time. It's very small, fits in a small place where our washer and dryer were, and it's really very simple. This is our previous gas system. We even have a more simple gas system in now with just one big tank and two backup small tanks. Takes very little room, extremely safe, and very simple. That's our oxygen tanks. They're called dewars. Here's a picture of some of our happy patients inside the chamber. So how does it work? Oxygen, 100% oxygen delivered at increased pressures dissolves oxygen in plasma, basically negating the need for hemoglobin. This results in extremely high levels of oxygen delivery to organs and tissues in the body. So as Dr. Crow said earlier, there really is no other drug that rescues any sick tissue better than oxygen. And so dissolving oxygen in the plasma gets oxygen where red blood cells or blood cannot get. And so hemoglobin. So let's talk about the physics of hyperbaric oxygen. We have to talk about it even though it's difficult. And this is from University of Tennessee's website, adopted from that. It's an excellent website with lots of really great information. So first of all, we have Boyle's law that tells us as the pressure increases, the volume of a gas decreases. Just like if you're putting carbon dioxide inside a soda can. That's how we get higher concentration of oxygen inside the lungs. Dalton's law tells us that the total pressure equals the combination of the partial pressures of each gas inside. So right now we're at 760 millimeters of mercury, that's sea level, at least I am. And that means that and we already know that air, room air, is made of 21% oxygen, 78% nitrogen, and about 1% of other substances. So that means that there's 160 millimeters of pressure of oxygen and 590 millimeters of pressure of nitrogen and 1 to 2% of the other gases. Graham's law tells us that gas diffuses from higher concentrations to lower concentrations. Very simple. Explains how oxygen gets from the air to our lungs into our tissues. And then Henry's law is the solubility of a gas in a liquid is directly proportional to the pressure of the gas in contact with that liquid. So the more pressure, the more you dissolve the gas. Very, very simple. Let's talk about the terminology that we use when we talk about hyperbaric oxygen. First of all, we talk about ATA, which is called atmospheres absolute. So when you're in a chamber at sea level, or all of us sitting right here, we are at 1 atmosphere. In order to get to 2 atmospheres, we're going to increase the chamber pressure by 1 atmosphere. 1 plus 1 is 2. So we're going to increase that chamber pressure by 1 atmosphere, or 14.7 pounds per square inch, which is equivalent to 33 feet of seawater. So that's to get to 2 atmospheres. Okay, so once you're at 2 atmospheres, you've increased the pressure inside the chamber plus 1 atmosphere, which brings you to approximately 33 feet underwater of seawater of pressure. So when the pressure is reached, you're at 2 atmospheres absolute, or 2 ATA. So that means we are in the chamber and we increase the pressure by 1 ATA. So 1 plus 1 makes 2 atmospheres absolute. Okay, well, we're going to summarize then. Gas goes into solution, bubbles shrink, and we create this extremely high diffusion gradient, all by the effects of increasing pressure. Just the pressure effects of hyperbaric oxygen. So if we take only pure oxygen and put it under pressure and put ourselves inside the chamber, this is what's going to happen. At 3 ATA, or the equivalent of 66 feet of seawater, breathing 100% oxygen, we're going to increase our arterial oxygen tension from 100 millimeters in room air to 2,000 millimeters of mercury. Our tissue oxygen tension is going from 55 millimeters in room air to 500 millimeters of mercury in our tissue. And our oxygen delivery per liter is going from 3 mils per liter to 60 mils per liter. So at 3 atmospheres absolute, we get up to 20 times more oxygen in the plasma and up to 5 times more oxygen in our tissues. It's so profound that in 1960, Dr. Burma did an experiment to show that you could live, or a pig could actually live, without red blood cells under hyperbaric oxygen. And what he did was exsanguinate a pig, left only the serum and the plasma in the pig, and put it under hyperbaric oxygen, and showed that he could sustain life in those pigs as they breathed 100% oxygen under pressure. That's how profound it is. So if we talk again about just the direct effects from pressure, here's what you're going to see. At 2.8 atmospheres, any bubble volume is going to decrease by 2/3. Remember the soda can in the pool, when you put it at the bottom of the pool, it compresses because the gas inside has gotten smaller. The dissolution of the gas bubbles prevents formation of new bubbles. An inert gas bubble is easily going to dissolve in 100% oxygen by replacing that inert like nitrogen, for instance, gas in the bubble with oxygen, and then that gets rapidly metabolized by the tissues. So imagine that when you're in a chamber, the gas from the compression in the chamber is going to decrease the gas from ileus, from bloat or severe interluminal gas accumulation, from perioperative gastrointestinal obstruction, gas gangrene, it goes down like magic, emphysematous biliary or urinary tract issues, and subcutaneous emphysema are all going to disappear. And that's due to the reduction in the gas volume. It's because of nitrogen, hydrogen, methane, and carbon dioxide diffusing into tissues and blood and dissolving and getting respired out. There's this very high grade now for removal of those gases out of the lungs. So obviously now, this is going to be a common theme throughout everything that we talk about. The decrease in pressure from gas in tissues or cavities is going to result in less injury from vascular compromise, decreased bacterial translocation, necrosis, pain, and swelling. This is going to be a theme that we're going to hear throughout this discussion. Okay, now let's talk about hyperoxygenation. Because besides bringing oxygen to damaged tissues in very high concentrations, we are compressing the tissues. And because the tissues are becoming more dense, we're creating a greater overlap of oxygen-rich tissues. So the oxygen just doesn't have to travel as far. Oxygen, and the other beautiful thing is that oxygen tensions are going to remain elevated up to 4 hours after therapy. And the results that happen because of that oxygen are going to last much longer, even weeks to years. And then one other thing that's very important is oxygen induces vasoconstriction, but it doesn't cause hypoxia because you're delivering so much extra oxygen. So even though it sounds counterintuitive, that vasoconstriction in all muscularized vessels, except for capillaries and lymphatics, is going to help decrease bleeding and oozing from vessels, and is going to help everything continue to circulate, let other fluids be reabsorbed. So that's one of the major methods of the action of hyperbaric oxygen, vasoconstriction. Another amazing feat is that it reduces swelling and edema, and you'll see that in a moment in a demonstration. But by decreasing the filtration of fluid from the capillary beds to the extracellular space because of vasoconstriction, while still being able to reabsorb fluid at the capillary levels and into the lymphatics, allows enhanced diffusion of fluid into the lymphatics and the capillaries. By reducing edema, you're decreasing capillary diffusion distances and you're increasing oxygen perfusion. And this fluid reabsorption helps inflammatory cells remove debris, and microorganisms, helps clean up the whole system. So here we go again, the decrease in pressure from edema reduction results in less injury from vascular compromise, decreased bacterial translocation, necrosis, pain, and swelling. You could quote me on that. Here's an example. So here's an example. We can talk about it and talk about it, but this is a really important example of Joe Boxer. He had a surgery done for severe necrotizing pancreatitis and granulomatous pancreatitis. So after dissecting away his pancreatic tissue, I got nervous, and so I decided it would be important to give him a plasma transfusion to help him through the recovery. Well, that was a great idea, except that he developed a very severe allergic reaction to the plasma transfusion, and I did not want to give him steroids post-operatively for this reaction. So he got hyperbaric oxygen, and in 1 hour, this is Joe Boxer immediately after 1 hour of hyperbaric oxygen at 2 ATA, no other treatment. So you can see the dramatic effect of edema reduction and how much edema reduction you can see in just 1 hour under 2 ATA. So if you can imagine what it can do in 1 hour, just reducing just edema, if it reduced edema alone, how much we could benefit our patients by using hyperbaric oxygen. When we talk about using hyperbaric oxygen in emergency situations, reducing edema obviously is extremely important, but it also is going to shrink the tissues, right? So if we, for instance, take crush injury or compartment syndrome, which emergency clinicians are very familiar with, we can see that in people, of course I stole this slide, I'm sorry, I know it's copywritten, I would give credit to it if I knew where the credit came from. But just so you know, this is an example of what hyperbaric oxygen therapy can do. Rather than having to open up a fasciotomy, do a fasciotomy and open up the muscles and create this more severe trauma, hyperbaric oxygen can shrink that tissue dramatically, negating the need to do that. So those tissues are not going to get compressed and destroyed, and necrosis is not. Here's an example of a cat bite. The leg is so swollen, the circulation is being cut off. It's going to cause necrosis and pain, everything we talk about. And after 2 treatments of hyperbaric oxygen, on day 2 you can see the dramatic decrease in the swelling. This is an example of treating compartment syndrome and also a cat bite and the infection and other benefits of using the hyperbaric oxygen. This is from my friend Dr. Julio Escalante in Mexico City. We're going to talk a little bit more about Dr. This is one of my favorite patients, Ein Nichols. This belongs to Rhett Nichols. You may have heard of him, the famous endocrinologist who was silly enough to allow me to treat his dog for lymphoma. But Ein was doing great, was getting adriamycin on January 17th. Unfortunately, due to his little stubby legs and veins, the adria extravasated into the leg. Was all very frightening, but fortunately we had the antidote there, which he received on that day, and again the next day as he's supposed to. We thought that everything was going to be fine. He did great, and he seemed better, but over the next month he seemed to get his leg began to swell. So we're guessing that probably the antidote also extravasated in the other leg. Regardless, the leg was very swollen and sore, and we started hyperbaric oxygen on March 5th, which was 3 months after. So 7 weeks post-chemo, this is what his leg looked like. And you may not be able to appreciate it, but it was extremely swollen, indurated, really, really, really bad. Oozing, filled with pus, and very, very scary. You can see the bottle of buprenorphine in the corner there. I didn't shave the whole thing initially because I was afraid Rhett was going to freak out, and frankly we were all freaking out. But right away we could see that the swelling began to decrease. It was so severe that you could see that he was scraping his toes, so he had some compartment syndrome for sure in that leg, causing nerve damage, and he was actually dragging his left front leg. But you could see the gradual decrease in the swelling over time. Here he is on day 10. You can see now you can actually see that he has a carpus. I'm comparing it to day 1 on the left side. Day 20 is treatment 25. You can see the hair is growing back very quickly, and there's no more induration. The redness is going away. Again, the old original one in the left-hand side there. And day 24, treatment 29, day 25, treatment 32. And you could see he wore his nails down from knuckling due to the nerve entrapment in the compartment syndrome. But at that point, the knuckling had stopped. There was still some induration in the armpit, but he was not painful anymore on day 34 at treatment 37. And day 52, treatment 46, he was significantly better. We treated him for longer than we probably had to because we could. But it sure beats the alternative, and here's an example of what happens in people. In people, it is extremely devastating, and imagine if they had a port in their chest, what that would look like. So I can't pronounce it, but the antidote and the hyperbaric oxygen are the antidotes that are recommended for adriamycin extravasation. So what's the moral of the story? The moral of the story is refer all corgis needing chemo. One of the most important things about hyperbaric oxygen is the reduction of free radical damage. One of the most important things oxygen does, or hyperbaric oxygen does, is bring oxygen to the tissues, and when we reperfuse tissues quickly with oxygen, we worry about free radical damage. But with hyperbaric oxygen, we get the best of both worlds, because not only do we get oxygen to get to the tissues, but we allow it to get there safely and reduce free radical damage at the same time. So very simply speaking, reactive oxygen species plus additional oxygen from hyperbaric oxygen will increase superoxide dismutase, and that will increase the reactive oxygen species that are scavenged. And so that's going to interfere with sequestration of neutrophils on the injured endothelium and reduce the initiation of reperfusion. It's going to affect neutrophil function, endothelial cellular adhesion molecule expression. It's going to modulate nitric oxide production, nitric oxide synthase expression, cellular energetics, lipid peroxidation, and improve microvascular blood flow. So basically, hyperbaric oxygen is going to antagonize lipid peroxidation of cell membranes from these toxic oxygen radicals. Hyperbaric oxygen also acts as an anti-inflammatory by having effects on leukocyte activity. It's going to decrease inflammation and increase bactericidal capabilities. So it's going to decrease inflammation by decreasing inflammatory cytokines that result in neutrophil rolling activation, transmigration into tissues, and local adherence. It's going to improve phagocytosis that's impaired by hypoxia. So it's going to replace the oxygen and improve phagocytosis. It's going to enhance granulocyte production of antimicrobial agents such as free radicals and reactive toxic oxygen species, so they can do their job, but not too much so that there's excessive damage. And in hypoxic conditions, normally macrophages are unable to scavenge effectively, and they really can't produce peroxidases that will generate inflammatory cytokines. So hyperbaric oxygen is going to increase oxygen to normal levels so that macrophages can function normally and do their job. Incredible bacteriostatic and bactericidal effects. It is directly bacteriostatic and bactericidal against several organisms, gram-positive, gram-negative, aerobic, and even anaerobic, especially anaerobic microorganisms, equivalent to the effect of some antibiotics. One perfect example is Clostridium perfringens. That's an anaerobe, and it's easily killed. It's killed immediately, really, in the hyperbaric environment. Not only does it kill the organism, but it's going to decrease the gas that is accumulated because of the organism in the tissues, and it's going to suppress the secretion of alpha toxin that the C. perfringens releases. Actinomyces is also very susceptible. And one of the things I want to show you here is this is Dr. Escalando's arm, and he was kind enough to share his story with us, his own personal story, where he was almost had his arm amputated because he was toxic from Clostridium perfringens. He had gas gangrene in his arm and was septic. And he had gone through multiple surgeries, multiple trials, and the day they were going to remove his arm, they said, let's try one more thing. They tried hyperbaric oxygen therapy. He was saved, his life was saved, and his arm was saved by hyperbaric oxygen therapy. And using hyperbaric oxygen ever since. In Mexico, he's the only veterinarian who has a chamber in Mexico. He actually had it made for the animals there and is doing phenomenally well. So thank you for letting us share your story. Again, we're talking about leukocyte-mediated killing of several aerobic bacteria and mycobacterium. Increasing the concentration of oxygen reduces infection. We see it all the time. And so we also know it can help with Lyme. It kills the Lyme organism. Lyme organism does not like the high oxygen environment. It's great for mycobacterium, it's great for Pseudomonas, it's great for staph, including methicillin-resistant staphs. So a lot of great uses, especially for back infections, post-op infections, animals that come in the ER with severe staph infections. We can stop the spread of the infection right away. Increases the efficacy of antibiotics. We just talked about that a little bit, but some antibiotics actually perform better with high. We don't really have time to go into the detailed physiologic mechanisms of action, but they are very detailed and they're very well written about in thousands of papers out there. I'd be happy to give you some excellent references. But just as a summary, it has an effect on prostaglandins, a profound effect on nitric oxide as far as regulating inflammation, infection, the microcirculation, and inflammation. It's going to have a great effect on the biological mediators of inflammation and wound healing by cytokines. Incredible detailed reports on exactly how it works on cytokines. And I don't really want to go into it because we would be here all day. This is an hour lecture in and of itself. Just to give you an idea of some of it, but it really is very physiologic based. It's not just, hey, look, this is what happens, but there is a very strong physiologic basis to why hyperbaric oxygen works as well as it does in the circumstances that it does. This is just a brief slide. I know it's very busy. I apologize for that, but I just wanted to highlight some of the emergency situations in which you may use hyperbaric oxygen. In this list are a lot of other reasons why you might use it, but just to highlight in green some of the emergency reasons why you may use hyperbaric oxygen. Talk about some examples. We'll get into the meat of this conversation and talk about examples. Pancreatitis is a nasty, nasty disease. We see it all the time in the emergency room. Some are worse than others. Sometimes it's hard to tell which ones are worse and which ones are not as severe. Ultrasound findings we know lag behind the clinical picture, so sometimes ultrasound doesn't look so severe when the pancreatitis is very severe. So what we do know is that hyperbaric oxygen will decrease the edema rapidly. Just like you saw on Joe Boxer's face, it's going to decrease the edema in the pancreas. Again, decreased edema results in less injury from vascular compromise, decreased bacterial translocation, decreased necrosis, pain, and swelling, reduction of reactive oxygen species, all of those things. But the decrease of inflammation is going to decrease the likelihood of thrombosis and microthrombosis, and it's really going to protect the microcirculation. So in my experience, pancreatitis doesn't get better like magic, but the animals feel better tremendously. They eat much sooner. Their edema reduces significantly. I treat them for 5 days regardless to prevent relapse and to maintain the improvement, because I have seen them treat only a few days and then they relapse, because we aren't stopping necessarily the process of pancreatitis, but we are slowing it and we are helping them feel better and reduce inflammation significantly. And I think that we can save their lives many times by treating with hyperbaric oxygen, especially if that's... Here's another great example of a case of necrotizing fasciitis that you'll see in the emergency room. This is a dog that was found in its driveway in excruciating pain. Nobody could get near it. It's a Doberman. And he came in with a very high fever, necrosis, sloughing of the tissues. It was just literally overnight that this had occurred, and they don't know exactly how it occurred. But you could see that it's very hard to tell in this picture where the necrosis is and what is actually going to happen. Of being in hyperbaric oxygen, now this is a little bit of an exaggerated, I mean, it's not a scientific line here, but I try to be as accurate as I can and show you the significant difference in swelling, where you can see there's a lack of waste in the first slide, and in the second picture there you can see that dramatic decrease in swelling, and also now the definition of the live tissue versus the non-live. It turned out that this is necrotizing fasciitis. It was from Pastorella, which is a facultative anaerobe. The dead tissue is a great place for bacteria to flourish. We got this dog in the chamber immediately. The bacteria, along with antibiotics, the bacteria likely died. The inflammation subsided enough where we could bring tissues closer together, and we could also then completely understand where our tissue necrosis was going to be and where our blood supply might be still viable. And we were able to treat him. On day 3, we were almost able to close the wound and even better identify where the areas of viability were, and significant areas of viability. And the decrease of inflammation allowed us to bring those tissues together. So all those different mechanisms that we talked about earlier, how it enhances efficacy of leukocytes, reduces intravascular leukocyte adherence, the direct antibacterial action of it, the antibiotic synergism, the inhibition of the toxins from the endothelial toxins, facilitating healing and attenuating reperfusion. All very well demonstrated here. As far as its role in healing, hyperbaric oxygen improves tissue repair quickly. It helps to improve necrotic tissue proteolysis. It enhances fibroblast proliferation. So by enhancing fibroblast proliferation, you're going to increase fibroblast growth. You're going to allow the production of collagen, increase collagen deposition and cellular matrix that's made by fibroblasts. Collagen cells, fibroblasts can't divide in low oxygen. So when you improve the oxygen content, you can allow the cells to make collagen where it's needed. It increases bone remodeling by improving osteoblastic and osteoclastic activity for bone healing and regeneration. It increases osteoclast and osteoblast production, proliferation, differentiation, and activity. This is all very well documented in scientific studies. Once again, happy to give you any references you would like. Speeds tissue removal and repair. It has proliferative effects on osteoblasts, and the collagen, again, made from these cells is going to create fibrous matrix, which allows new capillaries to grow into the fibrous matrix. Plus, so here we go with that topic, that hyperbaric oxygen promotes angiogenesis. So angiogenesis occurs in response to these high oxygen concentrations. And remember, we have angiogenesis and we have vasculogenesis. So angiogenesis is new vessels growing from existing intact vessels, whereas vasculogenesis is from bone marrow-derived endothelial precursor cells, which populate the tissue, differentiate, and grow into new vessels. And we know, and we'll talk about it a little bit later, that hyperbaric oxygen does increase bone marrow-derived stem cell production significantly by nitric oxide pathways. We know that. So we also, in a study done by Marks and Johnson, demonstrated that for irradiated wounds, hyperbaric oxygen induced neovascularization which became really significant after 14 treatments and continues for years after hyperbaric oxygen treatments have been ended. So hyperbaric oxygen is used as a pre-treatment for many people that are undergoing facial radiation therapy to increase the vasculogenesis and so that they can survive, their tissues survive this process of irradiation. It's very interesting. Again, we know that it mobilizes stem cells, so that's probably one of the most exciting effects. I keep saying that, don't I? There's a lot of exciting effects of hyperbaric oxygen, but one of the most exciting to me is that it increases the mobilization of stem cells in the circulation of patients. And this could explain a lot of what is seen in the physiologic activity, especially neovascularization. But it has been shown that a single 2-hour exposure at 2 ATA doubles circulating CD34 progenitor stem cells. And at 40 hours of hyperbaric oxygen, circulating CD34 cells have increased 8-fold. That's 800 times the amount of cells. The overall circulating white cell count is not significantly increased, though. You can do that with pharmacological intervention, but otherwise it doesn't affect the overall white blood cell counts. So this groundbreaking study really offers us a safe new therapeutic option for stem cell proliferation with very little risk of side effects. And that may be the reason for the improvement of arthritis symptoms, IMHA, tissue repair, chronic wound healing, all of these things by mobilization of progenitor stem cells. Lots of great effects on the central nervous system. Brain trauma, spinal cord trauma, stroke, a lot of these are very apropos for the emergency clinician. And I'm sure that you have faced cases like these where you sort of felt helpless. If you have a hyperbaric oxygen chamber, you will feel better. It's not the answer by itself, but it will certainly help in many circumstances. So let's look at some examples. Head trauma. This is one that, thank you Dr. Tim Crow for allowing us to utilize this slide. He calls this case Humpty Dumpty. This was a severe head trauma case. There was a wood thrown from a wood chipper cracked into this dog's skull and had to have surgery initially to clear out the fragments in his brain, and then immediately went into the chamber afterwards. So there's over 40 fragments on the right there that Dr. Crow had removed from this dog's brain or skull. And this is Ella, 1 day post-op, getting her hyperbaric oxygen treatment. She got 2 ATA twice a day for her head injury, and she did have brain injury. And 6 weeks later, after only 10 treatments, but she had other treatments as well, she did extremely well. Thanks, Dr. Crow, for that example. This is Kia, a 6-month-old dog who fell from a height.
Ya llegamos a la presión indicada para el tratamiento de Kia. Ella presenta movilidad.
That was Spanish for Ella presenting immobilized. She had 3 consecutive days of 2 treatments for 1 hour at 2.5 ATA each, then every other day, 1 treatment for 45 minutes at 2 ATA, and a total of 10 treatments over 11 days. Well, as you can see, 6 days and 8 days later, she was almost back to herself. Not completely.
Déjate limpio las barbas, ya te embarraste.
Here's a case of mine that I believe had a hypertensive stroke. I don't have a CT to verify it, but I probably would not have put this cat in a CAT scan at the time anyway. This is an episode of acute foreign limb paresis that occurred the night before. This kitty's blood pressure was over 260 and had petechial hemorrhages in the retina.
It slips under her. See, it's okay. That's it. That's what it is.
So you can see that her leg slips under her and that she is having a significant... After her diagnosis and an hour after her first dose of amlodipine, we wanted to try to get her blood pressure under control. This is immediately post her first treatment with hyperbaric oxygen.
I'm coming to this chamber. Can you bring her back tomorrow?
Yeah.
You can see she's significantly better. You can hear my associate saying, "I love this chamber, can you bring her back tomorrow?" That's my favorite line of all. But you could see a dramatic improvement. And then in this video, the episode occurred 4 nights earlier, and this was the first treatment. This was the 3rd treatment, but 4 days later.
That's a miracle. Except she sees you just now.
I know.
It wasn't long, but it's scary. It's kind of...
So they said it's a miracle, and it really is sort of a miracle, but she did have a seizure in the chamber, and animals with hypertension are more likely to have seizures. Older animals, cats that are hyperthyroid, are more likely to have seizures. It was about a 5-second seizure, self-limiting, as most of them are, and she didn't need any more treatments. But had she needed more, we may have pre-treated her with something to prevent seizures, like a small amount of Valium. Acute disc disease. This is a case of mine that I feel very excited about. This poor doggy had a acute disc, spinal radiographs. We did not have an MRI. We did not have a CT. I was criticized by another colleague of mine for not maybe thinking this could have been something else, but regardless of what it was, the dog went to walk. So I think that whether or not we're able to have the luxury of getting a definitive diagnosis, if we can get them walking again and feeling better quickly, then I'm all for it. So here's just a quick video of... So no significant improvement in the very early times. After her sixth treatment, she's walking. Unfortunately, in the emergency room, we see a lot of arrests, and we have to try our best to resuscitate, and sometimes we don't regain brain function from cerebral ischemia. We see cerebral ischemia from strangulation and from a number of other things, and we do know that using hyperbaric oxygen does help restore oxygen to the brain, does help decrease the edema very quickly, and can reverse many of the symptoms associated with cerebral edema, and reverse and prevent worsening symptoms from all those same things we talk about of decreased edema, decreased inflammation, improving blood flow, etc. Carbon monoxide is a very serious problem, toxicity from fire, as is cyanide toxicity. We don't often get the opportunity to treat animals for either of them, but if they do come into your emergency room and you happen to have hyperbaric oxygen, you can certainly improve their ability to survive this carbon monoxide poisoning and cyanide toxicity. Both are the mainstays of treatment. Hyperbaric oxygen can be the mainstay of treatment for both toxicities, although cyanide toxicity requires additional therapy, but along with oxygen. Also helps to prevent the worsening of burns or damage from burns, and smoke inhalation, burns to the skin and burns to the lung. This is Midnight, was found in Miami 1 week after a malicious acid burning of his skin. It's very sad. It was covered in maggots and was taken to Dr. Andy Turkel's practice in Boca Raton, Florida. Andy, as you know, is another very avid user of hyperbaric oxygen and one of my closest friends. So without him, I probably wouldn't be here. So thanks, Andy and Calusa. And Midnight, I'm sorry that you had to be. You recovered so well. Post-cleaning and pre-treatment on the left-hand side, in 6 days and 8 treatments later, you can see this just tremendous improvement, no infection, beautiful granulation tissue, no suturing, just perfectly, beautifully healing from the effects of good wound management and hyperbaric oxygen. 6 and 8 treatments later, 6 days and 8 treatments on the left, and 12 treatments 16 days later on the right. Really beautifully well, so that's a blessing. Spider envenomation, we don't see it very much in the north. We don't recognize it very much if we do, but the brown recluse spider is very common in the warmer climates, seen a lot in Florida, and sometimes we don't even know what animal bit, what insect has caused that problem, or if it was an insect, but a lot of times we will blame the brown recluse or another type of insect. Helps tremendously well. This is without hyperbaric oxygen intervention. The toxins destroy the tissue very, very rapidly, just a little bit like compartment syndrome, similar to the adriamycin type toxicity, where there's just sloughing of the tissue, severe local vasculitis, and compression of local tissues. Example of a spider bite right after suspected spider bite on left. Again, Dr. Julio Escalante. Thank you, Dr. Julio. On the left-hand side, day 1. Day 2, you can see tremendous improvement. In day 3, it's like nothing ever happened. So a dramatic difference from what could have happened, as you saw in the previous images. This is from Dr. Peter Brofman in South Carolina. Thank you, Dr. Brofman. He gave us an example of a cane-bred snake bite. Now, I didn't know what a cane-bred was, and I certainly didn't know what a BAMFer was either until I thought about it and how bad these bites are, and then I realized what they were talking about when they use that acronym, which is not polite enough to repeat. But severe bites happen, severe damage happens from cane-bred rattlesnake bites. The snake fought back. All 3 animals were presented with neurologic signs and severe soft tissue swelling to the face. After 2 or 3 treatments, I'm not sure if it was 2 or 3, without antivenin, it was a very, very rapid and significant improvement in just 1 day. That's a snake bite. Very, very severe. This is another very likely snake bite from Dr. Brofman as well. The whole ventral abdomen of this animal is indurated and ready to slough. The chin, you can see, is just incredibly edematous. This animal was given 4 treatments within 2.5 days, and obviously much more. And just 2 days later, he's almost back to normal. she is. And this, if left untreated, this would continue to swell and cause severe airway obstruction, severe necrosis in other swollen areas, and the process is immediately reversed here, so we don't have to deal with that. This poor puppy would have lost its skin. Let's talk about trauma. We often see lots of trauma in the emergency room. These are some pretty gross pictures. Hopefully they caught your attention. But fractures, acute trauma, crush injuries, all wounds, extremely helpful. Decrease that inflammation right away, kill the bacteria. Hyperbaric oxygen. We're going to decrease that swelling, decrease the bacterial infection. This is a patient from Dr. Shelton's practice in St. Francis Animal Hospital. Thank you, Dr. Shelton. In 9 days with only hyperbaric oxygen and superficial cleanings, no debridement. There was some sugar bandages, no surgical closure, and you could see how beautifully it's healing. Now, if you were to combine that with surgical closure and surgical debridement, this probably would be closed surgically by now. Excellent. This is another puppy dog from Dr. Escalante. He does so many treatments. Luckily for him, he's able to get a lot of cases in there and help tons of animals. I'm in a small private practice where I don't get to see as much, so I don't get to use it as much as he does, and I'm a little jealous because I know there's a lot of animals out there I could help. So hopefully by teaching you all about the benefits of it, you all go out there and refer to places that have hyperbaric oxygen chambers, or better yet, get your own. Anyway, this puppy dog had a severe osteomyelitis. You can see this fracture with the bone exposed, and after 17 days of medical management as well as hyperbaric oxygen, you can see this beautiful healing that has occurred. Gastrointestinal emergencies, we talked about pancreatitis. In an animal that I had that had severe pancreatitis, we could not push fluids, had severe mitral regurgitation, and really could only do the minimal fluids along with hyperbaric oxygen. It was a very severe case of pancreatitis, but the dog did do quite well. Bloat, post-op GI obstruction, peritonitis. I've had animals with perforations do very well after surgical resection and avoid having sepsis. Gastric ulceration, hepatic necrosis, toxins. It's incredibly helpful for acetaminophen toxicity and hepatic necrosis caused by acetaminophen toxicity. It helps a lot of cases of hepatic necrosis, especially including chemotherapy causes of hepatic necrosis, just as an aside. But carbon monoxide toxin, cyanide toxicity, acetaminophen toxicity, venoms that we talked about a little bit earlier, clostridial toxins, all endotoxins, all help significantly by the use of hyperbaric oxygen. There are several papers out there about hyperbaric oxygen and acetaminophen toxicity as well in people. We all know that hyperbaric oxygen can be extremely helpful in severe acute blood loss, or IMHA. Obviously, plasma is going to deliver oxygen to the tissues. We saw earlier that Dr. Burma did the study where the pigs didn't even need red blood cells. But, like we said, they're not going to be able to live in a hyperbaric oxygen chamber, so they're going to have to come out. But what it does is those effects are lasting, and even if the hematocrit's just a little bit low, or is low, but they can survive with it, this is going to provide the whole body a lot of supportive care in the meantime. In cases of hemolytic disease, red blood cell breakdown releases carbon monoxide locally, and that can further block oxygenation in the intact red blood cells. So hyperbaric oxygen is going to help to dissociate the carbon monoxide and allow red blood cells to carry oxygen better. It's going to improve red blood cell deformability, reduce swelling and inflammation associated with vasculitis, which is often seen in immune-mediated diseases. It's going to combat the hypoxia from micro or macrothrombi that might occur. It's going to improve bone marrow stem cell circulation and bone marrow stem cell production. It's going to protect the microcirculation, as we talked about, and hopefully decrease inflammation and decrease that coagulation cascade. In many other inflammatory and infectious emergencies, we talked a lot about what mechanisms these may work in, but just to quickly review: septicemia, endotoxemia, allergic reactions, GME, granulomatous meningoencephalitis. We do believe it is extremely helpful in those cases, sometimes requiring chronic therapy over years, but it will definitely help improve the clinical symptoms. I've seen animals with Rocky Mountain-induced vasculitis improve overnight. Significant improvement. Of course, they're not healed, but a significant start. It does help support animals through immune-mediated polyarthropathies. Septic arthritis, sort of self-explanatory. Acute Lyme disease we talked about. And of course, abscessation, acute intracranial and abdominal abscessations can be well affected by hyperbaric oxygen because oxygen is going to be able to get into those tissues where it otherwise was unable to reach. So in veterinary medicine, we don't have great treatment protocols that we could say to everyone, this is what you have to do. And just much like everything else in medicine, everything is going to depend on the situation and the circumstances at the time. But you do have to be careful. I mean, hyperbaric oxygen can produce toxic effects if you're not careful, and sometimes even if you are careful. So you have to take care and make sure you're using safe time limits. We really do not want an animal in there for more than 90 minutes as it can cause oxygen toxicity. For people that are in there more than 90 minutes, they usually take an oxygen break where they breathe air for a period of time before they continue along breathing 100% oxygen under pressure. Dosing is disease specific, so for certain things you may need 20 to 40 treatments. For certain things you may need 1.5 ATA versus 2 ATA. It's not something that we can really review quickly here, but we could certainly make any type of recommendations at any time. If you'd like to reach out to me, I'd be happy to be there for you. Certain treatments need to be given once a day, twice a day, sometimes for very severe cases, even 3 times a day. What are the risks and the side effects to our patients? Well, in people, we get middle ear barotrauma. It's very uncommon in patients, dogs and cats. If it is common, we don't know. They don't complain, they don't cry, but they do swallow, they do yawn, so we do know that they are trying to clear their eustachian tube to some extent. We aren't able to detect sinus issues, but again, they don't seem to be in any type of distress related to that. Pulmonary barotrauma, trauma to the airways is very unlikely under 2 atmospheres, but if you aren't careful and you increase pressures quickly, you could have a problem when you are coming up to normal pressure from higher pressures. Oxygen toxicity seizures are pretty common, I would say. I hate that they are common. The sicker animals tend to have seizures more frequently than the healthier animals, but it's sometimes just happens in the very old animal, the hyperthyroid cats, pre-existing epilepsy, animals with fevers. Sometimes we just see it in sick animals and we're not exactly sure when, but usually they are self-limiting. They do not require treatment, and if it is going to happen and the animal requires continued treatment, you can pre-treat with a diazepam to prevent that. We see very few complications overall. We've seen animals maybe get stuck in an area where you wouldn't have expected them to move. They have some anxiety. Rarely we'll see an animal vomit. Theoretically, it lowers blood sugar in diabetics. For long-term treatments, you may need to decrease insulin doses on days of hyperbaric oxygen therapy. In some very preliminary work that I've done, I have not seen significant lowering of blood sugars in healthy animals and not significant lowering of blood sugars in diabetic dogs either, but that's only on a few cases. So what are the contraindications to using hyperbaric oxygen? One absolute contraindication would be untreated tension pneumothorax. If there's air outside of the lungs and we compress the air outside of the lungs, we're going to smush the lungs and the patient's not going to be able to breathe. So that's the #1 contraindication. Emphysema, any animal that might have air cysts, blebs, or bulla on chest radiographs could potentially have rupture of a bulla on coming back from high pressure to low pressure. Uncontrolled fevers. Fever can lead to oxygen toxicity or seizures. I'm not sure about pregnancy, although it has been listed as a contraindication. And the use of certain drugs within a certain amount of time has been controversial, has been shown to, in some of them, be an absolute contraindication, and others assumed contraindication. So one thing we also have to realize is that when there's increase in pulmonary vascular resistance and slightly decreased cardiac output, you really have to be very careful. We are causing vasoconstriction, we're causing lung squeeze, we're going to decrease the cardiac output a little bit, and we may be causing some relative pulmonary hypertension. So we have to be careful, especially in patients with things like anuric renal failure, for instance. If the animal's lymphatics are at capacity and they are not able to produce urine and they are a little bit overhydrated, there is nowhere for this fluid shifts to go as a result of hyperbaric oxygen. So when we put pressure on the body and we have all these fluid shifts and our lymphatics are supposed to carry away the fluid that's in the interstitial spaces, if it's has nowhere to go, it's going to take the path of least resistance, and that is going to be into the lungs. And we're going to have fluid buildup in the lungs, and we're going to cause death. So we have to be very, very careful about anuric renal failure, about late-stage vasculitis, about animals that are very, very compromised. They're not good candidates to go in there. Animals with mitral valve disease or tricuspid valve disease that are well controlled can absolutely tolerate hyperbaric oxygen. It's fine. But when they have poor contractility and poor function, the muscle's not able to contract, you are going to potentially put them at risk. You do not want to put an animal in heart failure, active heart failure, in the chamber. However, if they have a stroke, an animal has a stroke, or a person has a myocardial infarction and there's still good contractility, this could potentially restore blood flow to the heart muscle and could save them under certain circumstances. Unfortunately, we would not be able to know that in a veterinary patient, not likely be able to know that in a veterinary patient. But just be very careful in situations of heart failure. Here's just a quick example of Hercules who had a disc problem. He is a boxer, but he had been presented a year or 8 months earlier for a similar issue and had a disc that responded. And so we took chest x-rays just to be absolutely sure there was nothing wrong, since he was a boxer. He did have a disc lesion at T13L1 and L1L2, but what we didn't notice, he actually has a small bulla in his airway, and so hyperbaric oxygen would have been potentially contraindicated for him, or we'd have to weigh the risks and the potential benefits of doing hyperbarics in him. And then one thing that's really, really exciting is the use of hyperbaric oxygen in stem cells. So there have been some recent studies that show that the effect of oxygenation on stem cell therapy will enhance stem cell therapy. So in this image here, you see a mouse model on the left is the mouse's heart with myocardial infarction. An animal a similar patient with a similar lesion with hyperbaric oxygen alone on the right, there was no significant improvement. With mesenchymal stem cell treatment on the bottom left, significant improvement, but not as much as to the right, where they did mesenchymal stem cells along with hyperbaric oxygen and saw a much greater effect on the therapy for myocardial infarction. So it does show some extreme promise there for the future of the combination of hyperbaric oxygen and stem cells. And another exciting study is the use of bone marrow stem cell transplant along with hyperbaric oxygen for the treatment of diabetes. And that is our ongoing studies now as well. And we do know that in veterinary patients that have diabetes or type 2 diabetes, we can reduce the amount of insulin required, and in cats they can actually reverse the diabetes process. And that's not published yet, it's just some anecdotal work that's been done, but it's very, very interesting. And remember that a lot of diabetes is thought to be an inflammatory disease, so it does make sense that we might be able to help. These are just an example of some of the hospitals at the time we gave this lecture initially that were partners with Hyperbaric Veterinary Medicine, of which I'm a partner. And I want to thank them very much for giving us the opportunity to give these lectures to educate people about how important it is, but most importantly for allowing us to provide hyperbaric oxygen to our patients in an affordable way. These things probably would have been more popular and utilized more if they were affordable in the past, but it wasn't feasible for veterinarians to buy a $40,000 machine, which is actually a used hyperbaric oxygen machine, when we could pay per use by using something like the system that Hyperbaric Veterinary Medicine has designed. So we're very grateful for them to put in the effort, the energy, and to educate us, all of you, and to make hyperbaric oxygen available for our patients. So thank you very much for your. Just as an example, in a small private practice that I'm in, I have only 2 doctors. I'm an internal medicine specialist. I work with a generalist. These are some of the treatments we did in 15 months, in our first 15 months. Since then, we've done gas gangrene and several other exciting treatments. So just think about, if this is what I can do in a small practice, what you can do in a large practice and in emergency medicine. Thank you.